Good morning, everyone. My name is Rialie Hymas, and as a parent, I know firsthand how hard it can be to keep up with everything families need. Between rent, groceries, school supplies, and bills, healthcare can often feel like a luxury, not a necessity. I've been in that position where you have to decide, do I pay this bill or take my kid to the doctor? And sadly, many parents across the country face that same choice. But when it comes to vaccinations, something that can literally save our child's life, no parent should ever have to face. That's why today I'm arguing that the Centers of Disease Control and Prevention, also known as the CDC, should require all children to follow the recommended vaccination schedule before entering school and ensure that vaccinations are free of charge. This policy would protect individual children, strengthen entire communities, and remove financial barriers that keep families from accessing basic preventative care. First, vaccines save children's lives. It's that simple. The CDC estimates that vaccines prevent over 4 million deaths worldwide every single year. Think about that. 4 million people who get to grow up, go to school, live their lives because vaccines stop diseases before they could spread. Here in the United States, we've seen power of vaccines firsthand. Diseases like polio, which once paralyzed thousands of children annually, were completely eradicated from our country by 1979, thanks to vaccination efforts, but we've also seen what happens when vaccination rates drop. In 2019, a major measles outbreak in New York affected more than 1,200 people, mostly in communities with low-income vaccination rates. Measles can lead to pneumonia, brain swelling, and even death, yet it's entirely preventable with one simple shot. Mandating childhood vaccines ensures that children are protected. It's not just about one family's decision. It's about keeping every child in the classroom, the playground, and our community safe. Vaccines don't just protect individuals, they protect entire communities, which this is called the herd immunity. When enough people are vaccinated, typically around 95% of community diseases can't spread. That means we're protecting not just our own kids, but also infants who are too young to get shots, and children with immune conditions who can safely be vaccinated. Unfortunately, not every family has the same vaccines. Even though programs like the Vaccines for Children, the VFC, programs already offer free vaccines to low-income families, many parents don't even know this program exists. Others face transportation issues, work conflicts, or long wait times at clinics. That's why my proposed policy includes a second piece, making vaccines free and accessible to all families through school-based clinics, mobile health units, and public outreach. When cost and access barriers disappear, vaccination rates go up, outbreaks go down, and communities grow stronger. No child should be left unprotected simply because their parents can't afford health care. Now, some people may argue that vaccines should be a personal choice. That parents should have the right to decide. I completely understand wanting to make the best decision for my child. I'm a parent too, and that's what we all want. But here's the truth. Personal choice ends when it endangers others. Choosing not to vaccinate your child doesn't just affect your family, it affects newborns, children with cancer, and others who rely on the herd immunity to stay safe. Opponents also claim that vaccines aren't safe, that they're linked to autism. However, science has overwhelmingly disproven these claims. A 2014 meta-analysis of over 1.2 million children found no connection between vaccines and autism. The side effects that do occur, like mild fever or a sore arm, are temporary and minor compared to the risks of diseases like measles and whooping cough, which can cause hospitalization and even death. So while some may view mandatory vaccines as limiting freedom, in reality, it's a policy that protects everyone's right to live safely, especially our most vulnerable children. So in closing, requiring all children to follow the CDC vaccination schedule and ensuring vaccines are provided free of charge is one of the most effective ways to protect our nation's health. It saves lives by preventing deadly diseases, it strengthens community through herd immunity, and it removes barriers and prevents families from accessing care. Parents should never have to choose between paying rent and protecting their child. Vaccines are safe, effective, and life-saving, and access to them should be a right, not a privilege. So I leave you with this. Protecting our children through vaccines isn't just a smart policy, it's a moral responsibility, one that ensures every child, regardless of income, background, or circumstance, gets the chance to grow up healthy and strong.